Let's tell you about the situation in Nigeria's health care system. It's indeed a situation that many are talking about, especially the Deputy Speaker of the House of Representatives, Benjamin Okezie Kalu, is criticized the unending exodus of the country's medical professionals. Now, this comes barely after an alleged report says that Lagos University Teaching Hospital, LUTH, has closed down 5 wards with 100-plus beds due to a shortage of doctors and nurses. President Bola Tinubu's administration gave approval for doctors, nurses and other clinical healthcare workers to be appointed as contract staff after attaining their compulsory retirement age of years. Nigeria has experienced a decline in the country's health manpower, poor remunerations, a lack of state-of-the-art infrastructure, and many more have been considered as reasons. The situation is indeed worrisome. Well, hopefully we'll get our guest to join us. He's trying to join us pretty soon. He's a current affairs commentator and, of course, a medical expert, a doctor himself with many years of experience. And he's seen the mass exodus of even personnel at his very own clinic too. So this is a conversation that's gotten everyone talking. Osarogie. It's indeed deep, especially one that struck me the most is the fact that LUTH, which is known to be the premier medical center here in Nigeria, particularly in Lagos, is indeed decrying the worrisome exodus of medical healthcare workers who are indeed leaving the country in droves. And the report says about 143,900 Nigerian doctors have moved to the UK.
Yeah. Statistics that, for 2023 showed, how many Nigerians also exited Nigeria to the UK. I believe in 2023 was much higher than, I'm not sure what, country that I saw, but it was, Nigeria was definitely one of the highest countries, with immigration. But, before we even talk about the medical aspect, it's important to also mention that this is not just a healthcare challenge. This is affecting every sector in Nigeria because the exit of Nigerians looking out for greater pastures in other parts of the world has been going on. You've just mentioned more than 140,000 people have exited in the last couple of years. So imagine what it's done to the banking sector, what it's done to FMCGs, what is done to telecoms, what is done to other government state house, what is done to the families, even the family sector, if there's anything like that. People now are leaving thousands and thousands of miles away in a totally different continent. They have no idea when they're going to be back home to see their parents again or their siblings again, even to see their wives or children. So it's affecting every sector, including the health sector. And yes, of course, the average Nigerian will be the one who will suffer it the most, because whoever they now have, because you just read now that the president has given approval for contract staff. Those do not have the amount of experience or training that is required to take care of, health challenges across the country. So we will suffer. We have Dr. Tuyi Mebawondu joining us this morning. Good morning, Doctor. Thanks for joining us.
Good morning. Can you hear me very well?
Absolutely.
Yes, we can. Great to have you on the program.
Good morning.
Okay, if you can hear us clearly, I would like that you give paint a picture of what the reality is like in healthcare facilities across Nigeria with the Jackpot season going on. What is the reality now? Is it that bad that you don't have enough staff to carry out basic health care services, both in private and public facilities?
Yeah, let me talk from personal experience. When I had a reason to send one of my family members to an hospital for a procedure. Okay. First and foremost, it came as an emergency, and I have to send him to a state hospital in Lagos Island. Stayed there for a long time, a whole day. That's why the emergency couldn't get attention because one, the few bed space available were have not occupied, and then he has to be sent again to another hospital in mainland, to another community hospital, to Federal Medical Center, ended at LUTH, and there ended at LUTH, where after 2 days was able to stay somewhere at the emergency room and had some attention. Now, it's not just that we are not getting people to attend to, or there's a constitution of space, there's limitation of medical personnel, There's a lot of pressure on doctors working, those who want, or health workers working there. And at the end of the day, people tend to have negative experience of the healthcare system and then seek care outside the health system or even at the paramedical system. I will also give you a clear example of another very close relative of mine. I'm talking about myself now, who is a doctor, who's been in this workspace for quite a long time. I'm telling you about my experience. Of course, a very close friend to me who was having a baby, of course the fourth baby, and then couldn't get to hospital, ran to these authority people, and she bled to death. So it's real. The health crisis in Nigeria is real. If you've not experienced it, you know, maybe you should thank God. But one day, very soon, all of us will experience it. And it's real. And then it's something we need to do whatever about. Anyhow, if we want to put confidence in our health system, if we want to put confidence in our economy, if we want to ensure that we change the negative narration of negative indices Nigeria is having health-wise all over the world. So the situation is quite pathetic. I am sorely afraid of me falling sick and needing some really emergency. That's where we are now.
If doctor, I mean, if you as a doctor, you're afraid, I wonder how the common man at this point should feel if a doctor feels so afraid. But then again, this is a conversation that we really need to dissect. And the House of Reps, deputies, I mean, Speaker there, had spoken alongside other members saying that they are worried. The figures show 143,990 doctors and nurses have jackpot. They've left the system. We can see vacuums being created. Now, the president, in trying to ensure that he could cushion the effect that this would have, has called back from retirement all doctors and nurses to come in as contract staff. Of course, they will still retain their former salaries. There's no increase and so on. Is this in any way going to help the situation? Or should Nigerians begin to seek alternatives in the best way possible?
Well, for people, you see, I think, honestly, for me, we're doing what I would call a fire brigade approach to everything. We saw that this is the situation here. The person said, okay, what can we do? Go and call people. Please, you should note that health work is a very stressful work. I can tell you that, very stressful work. You have to be there, attend to a lengthy period of time, number of patients, and then take tough decisions. And it requires some really level of fitness in a way. So it's not football, but it requires that level of fitness. Let me tell you, what we need to do is sit down and appreciate the fact that health system is not just about hospital or people coming to hospital, attend the hospital. Yeah, it's a critical aspect of it. But let me ask you this question. What has happened to our primary healthcare system? 30,000 primary healthcare system, only 6,000 of them, barely 6,000 of them working. What has happened to our primary healthcare system? Where we can actually filter as much as 80% of all the health problems we have in the country. I think we need to sit down, put attention to where attention is needed, look at our primary healthcare system, try to strengthen it wherever it is. And then again, what has happened to the role of local governments in trying to deal with the health system? Because a lot of this healthcare system can be healthcare can be done by even simple algorithms, simple protocol at the primary healthcare level. So, but what has happened to all those ones? So now it sounds good to say that I'm calling health workers from retirement. But honestly, I'm sure you cannot come and be running around trying to ensure one surgical procedure is done. Because I'm sure a lot of people, even if you are calling them back, how many can you actually get? 1, 2, how fit are they? How ready are they to actually be part of this work system? But my own counsel is this: go back to your primary healthcare system, go back to your health literacy, inform people, talk to people, let them have knowledge of how to behave in a health challenge situation. I think we should start from there. Fire brigade approach will not resolve any problem. And then, of course, in relation to that, you must be able to have a clear understanding of the number of doctors. I mean, one estimate says that we need more than 200,000 doctors to be trained. Even now, but again, we can only train about 3,000 every year in all our capacity to train. There were the capacity to train, indeed, in this country. We don't have capacity to train. And then training your doctors, of course, you need doctors to train doctors, right? But where are those people that are supposed to help you train the doctors? So, in reality, well, it's good to call doctors, those that can still do those work, but let us and address the real issue. That is key.
I think it's important to say
health literacy.
Dr. Mebawondu.
Things that will help your people.
Yeah, I think it's important to say that the jackpot season, the reasons behind Nigerians living in droves heading out of the country is not just because primary healthcare facilities are not properly built. It's not the reasons doctors are leaving is not just because of those little details here and there that you've mentioned. They're legitimate reasons, but it's not a doctor thing. It's a Nigerian thing, so it's Nigerians that are leaving, and that includes doctors. I want to, because I remember a couple of years ago, I think it was between Osarogie and Chris Ngige, there was some argument about how they need to create new laws to ensure that Nigerian doctors practice for a couple of years here in Nigeria before they are allowed to work outside, given a work permit to work outside the country and all that. So I want to know what you think the National Assembly or the House of Reps should be discussing now that they seemingly see that there is a problem in the health sector. What would you say that they should be discussing with utmost importance at this moment?
You see, they've come with all sorts of proposals, how to hold doctor here, how to criminalize their exit and all those things. It's actually, poverty of thinking in a way. The simple thing is this: if you want to retain doctors, then what we call the push factor and the pull factors, make the service condition very good. Make the service condition very good. Look at our health infrastructure. It's pitiable. Okay? Look at the condition of service for a doctor. It's not just there. Even in training, the doctors must have to, the doctors in training or the health workers in training, don't let me use doctors, have to actually struggle, pay high fees, buy expensive books, expensive accommodation, without input from anybody, no scholarship, no nothing. And then how do you want to now ask those people to stay and hang around with this country? Which law? If you cannot compel all that people that are jackpying in a way, IT guys, lawyers, bankers, teachers, if you cannot compel all those people to stay, why singular doctors, for goodness sake? For me, why singular doctors? So if you want to make those laws, make it so pervasive, so thorough that it will touch everybody, okay? Don't wake up and say, doctors, you cannot go. You know what you're going to get? You see a lot of people trying to, because of that singular thing, a lot of people will move away from the health profession. Even those ones that cannot jackpot will jackpot inside. Because you can be trained as a doctor and choose not to practice the profession if you want to put constricting conditionalities around the practice of medical treatment. And people will challenge it. I'm sure people will challenge that. Why should doctor be singular? You must be able to give critical examples. You have not paid for them. You have not ensured the training rests upon you. All you want to do is to use their facilities. I am a doctor. I know what all of us went through to practice. I have children causing sick from my own daughter who is practicing medicine. I know what I am going through. Who is training to be a doctor. I know what I'm going through in trying to train them in those health professions. So why will anybody want them to come and hang around if they don't want to hang around? Encourage them, do things that will make them stay and hang around. Okay? Provide, for instance, if you look at non-salary remuneration for health workers, like you are providing houses for them, you are providing car loan for them, you are providing scholarship for their children to go to school, 1 or 2 of their children to go to school, they will stay around and fulfill that bond. It's not by waking up a National Assembly and enacting law. Let's also enact law for all the politicians to take their treatment in this country, for their children to stay in this country to go to school, for them not to ever fly abroad, for them to use made in Nigeria vehicles. Let us, if we want to be serious, let us be serious. Let's look at these things in complete realm, not just waking up and saying that, oh, doctors, you must not move to this place, you must not go to this place. It won't work. It won't work.
I'm sure this conversation, I mean, I wish we had more time, but we'll have to bring you back, Dr. Tuyi Mebawondu, for being here. Thank you so much for being here, by the way. I look forward to have you again. The discussion also expands on the members of parliament, the president himself, always traveling out for medical procedures and not taking his healthcare system. You know, it's long, it's broad, but then again, like I said, we'll have to bring you back. Thank you so much for joining us this morning.
Thank you, Joe. Thank you, Kofi. Nice seeing you guys.
All right. Thank you.